Hello, and welcome to this video on the result displays that you and your patients can review once the patient has completed their N of 1 trial. In this video, I'm going to show you the different types of graphs you can use to help make treatment decisions. These graphs will be available to you and your patient in the desktop interface and will be viewed on a computer during a clinic visit after the patient's N of 1 trial is complete. While you will be able to see a number of different graphs displaying your patient's trial data, it is not necessary to explain every graph to every patient. You can choose which graphs to discuss based upon what makes the most sense for your patient. Now, we will review some of these graphs. This graph shows pain levels changing over time. The graph has a 0 to 10 scale, where 10 is really bad pain and 0 is no pain. The patient has been taking Vicodin for a period of time, then Advil, then Vicodin. We can see some patterns. It looks like pain levels are a little lower on Vicodin. However, over a longer period of time, it can be hard to tell which treatment was better by looking at this graph alone. That brings us to our next graph. This graph shows average scores during the trial for pain and a number of secondary measures, which include fatigue, drowsiness, sleep problems, thinking problems, and constipation. As in the previous slide, we have a 0 to 10 scale where lower scores are better. Looking at the first set of bars, the average pain level for this patient was about 3.5 on Vicodin and 5.5 on Advil. Moving to the right, we see that Advil results in better outcomes along all 5 secondary outcomes. But are these differences meaningful? We'll have to take a look at another graph to find out. This graph shows all of the outcomes we discussed previously represented as horizontal bars, one for each primary and secondary outcome. For each outcome, if the small circle is to the left in the red zone, Vicodin is better. If the circle is to the right, in the blue zone, Advil is better. But we also have an additional component that wasn't shown in the previous graph. Lines or bars indicating the margins of error. The results for pain, as we saw before, are clearly better for Vicodin than for Advil, and the margin of error doesn't cross into this neutral zone. So we can be pretty confident this is a true effect. On the other hand, most of the other outcomes seem to favor Advil. Some of them, like thinking problems and drowsiness, have margins of error that don't cross into the neutral zone. But for sleep problems and constipation, we can't be quite so sure because the error bars do cross into the neutral zone. So overall, we see that in this case Vicodin is better for pain control, but Advil showed fewer side effects, particularly with respect to cognitive ability. Hopefully these types of results available to you and your patients will lead to decisions that are informed by evidence, more patient-centered, and more individualized than what would have been possible before the N of 1 trial was undertaken.